The story that we have talked about, the powerful late-night TV moment that perhaps led to some of the concessions to moderates on this health care redo because there was so much focus on it. Jimmy Kimmel revealing that his newborn son needed emergency surgery at Cedars-Sinai. Look how cute he is. At the medical center in Los Angeles. His life was saved by doctors and nurses, prompting this emotional plea on his show.
Before 2014, if you were born with congenital heart disease like my son was, there was a good chance you'd never be able to get health insurance because you had a pre-existing condition. You were born with a pre-existing condition. If your parents didn't have medical insurance, you might not live long enough to even get denied because of a pre-existing condition. If your baby is going to die, and it doesn't have to, it shouldn't matter how much money you make. I think that's something that, whether you're a Republican or a Democrat or something else, we all agree on that, right? I mean, we do. Let's stop with the nonsense. This isn't football. There are no teams. We are the team. It's the United States. Don't let their partisan squabbles divide us on something every decent person wants. We need to take care of each other.
So those comments prompted this Washington Post headline, "The GOP has no good answer for Jimmy Kimmel," says the Post. In moments, we'll hear from Charlie Hurt, who says that Kimmel is acting like an elitist creep. He will defend those comments in a moment. But first, Dr. Zeke Emanuel, known as the architect of Obamacare. He is also a Fox News contributor. Doctor, good to see you today.
Nice to be here.
What I would like you to take us through is whether or not the second part of what Jimmy Kimmel said, and we all sympathize, any parent who has been through the frightening and joyful experience of having a child and wanting to make sure everything is okay, feels for what he and his family went through, there's no doubt. But in terms of whether or not it would have been different, just the facts, beforehand, when a baby is born, if his family is destitute and the baby's in the hospital and the baby starts, God forbid, turning purple, they don't walk away from that baby. They do surgery on that baby, regardless of the insurance situation, correct?
First of all, let's be clear. Yes, first of all, the mother might have been in a very different hospital than Cedars-Sinai, and so the quality of the hospital would have been affected.
Well, that's true under Obamacare or not under Obamacare.
Let me just finish.
Go ahead.
The second thing is the idea of transporting the baby to Children's Hospital might have been different. And we do know, just as a matter of fact, actually, that people are treated differently by their insurance status. There was a study done by a Professor Doyle out of MIT that looked at accident victims in Wisconsin, and there was a very big difference in outcome as to whether you had an insurance, you were insured or uninsured, and the uninsured people actually died more frequently. We also have data from the American Cancer Society.
Let me just jump in. I understand what you're saying.
Let me just finish.
But you're going into a lot of different scenarios, and just for the purposes of this discussion, because we only have a few minutes, I want to talk about a baby in a hospital. Because what happens is, even before Obamacare, in fact, insurance companies added newborn infants at standard rates.
You would like to narrow your
regardless
case.
I'm just saying that we all felt for what he was saying, doctor, but I want people to understand that there's no, mean being out there who's not going to help a child who is just born hours before if they are in dire need. And is that correct?
It's very interesting how you want to narrow the case. Remember Arizona.
I'm just talking about the story.
A few years ago. I'm about to explain something. Arizona, a few years ago, decided that they were going to take away coverage for Medicaid patients for life-saving bone marrow transplants for children. And, in fact, some children died. Oregon ended up doing the same thing. So the idea that we don't take care away, life-saving care away from children because of their insurance status, whether it's Medicaid or being uninsured, your point is just wrong. We do that, and I think Jimmy Kimmel was making a very accurate claim that your insurance, whether
you're saying that although I'm right about this case, there are other cases where there's concerns, and I hear you, and we all want children who are in these situations to be taken care of. But the other point that you made about what Obamacare is not going to cover someone to move to Cedars-Sinai or to move to Children's Hospital. I mean, that's not...
Excuse me. You're not factually correct.
No, I've been factually correct all throughout, but go ahead.
Half the people who got coverage have private insurance and often go to Cedars-Sinai. Cedars-Sinai takes patients with Medicaid as well.
That's right.
And the fact that let me just finish. The fact is, what services are covered do make a difference, and the uninsured, we know, have had a higher mortality rate, in part for many reasons, but in part because of that insurance status, even in emergency circumstances like the one you're identifying.
Right. But thank God, I think we can all agree that in this situation, any baby would be given care by the good doctors who would be in the hospital where the child is. I got to leave it there.
Jimmy Kimmel's claim that your insurance status can determine the kind of medical care you get, even in a hospital, turns out factually, when you look at the data, to be true.
He wants to make sure they're covered, and so do all of us.
Situation is whether you have good insurance or not good insurance, and that is the situation.